And employees blowing the whistle tonight on what they say is inhumane care at a local nursing home. 11 Investigates' Angie Moreski continues her report now, working to get answers for residents and their relatives.
I feel guilty for putting you here. I feel guilty.
This family member who wants to remain anonymous says she filed a complaint with the state several weeks ago about her loved one's care.
There's times that there's been 28 days between a shower.
Do you think some of the care is inhumane?
Yeah.
I have been here since March 20th.
Beth Moore is a resident at Murraysville Rehab, and so is her son Michael, who's been here for 5 years.
The care is the big issue.
She says she also complained to the state but got no satisfaction.
Are you surprised that they weren't cited at all this year for any violations?
Very surprised.
I called anonymously to the State Department.
Even employees say they've tried but got nowhere.
The state comes in and it just seems like they walk around, they look at things, they go in the office, talk, they're gone. That's the end of that. We hear nothing, see nothing.
This is Angie Moreski with Channel 11 News, and we had some questions about patient care, and we wanted to speak with your administrator. We called Murraysville Rehab trying to get some answers. Is it impacting patient care? The administrator took the call and said he thinks they are providing a level of care that's acceptable, but added you can always improve. Is that good enough, though, for the residents there? He wouldn't talk further, saying he had to get corporate approval. He got back to me, declining the interview and providing an email to a PR company for inquiries. Comprehensive Healthcare Management owns Murraysville Rehab, the same parent company that owns Brighton Rehab in Beaver County, which had the worst COVID outbreak in the state and was criticized for its secrecy.
That's my mother up there. There should be no secrets.
Comprehensive also owns Monroeville Rehab, which 11 Investigates recently exposed had an outbreak with more than 50 COVID cases, not revealed until after we started asking questions. For months, 11 Investigates has repeatedly requested interviews with Comprehensive, each time denied, a pattern these women say of avoiding accountability.
I think that we do excellent inspections.
The State Department of Health is responsible for regulating nursing homes. We took the care concerns to the top in a one-on-one interview with Department of Health Secretary Dr. Rachel Levine.
Every single month this year in 2020, we've seen complaints that were not substantiated. And family members, residents, and staff are saying these things are still occurring, and yet no one is substantiating them.
Sometimes when someone complains about something, it's changed by the time when we get there.
Do you think inspectors need to be tougher?
I think that we have become much tougher.
But families say the talk doesn't match the action.
I've called the governor's office. I've called Dr. Levine's office. Nothing happens.
Are you worried that patient care is suffering because COVID is taking so much of the attention that complaints about basic care are not getting the attention they need?
There are certainly challenges in all of the facilities balancing the issues in terms of COVID-19 versus the other medical concerns and issues that patients have.
What do you say to those folks who say, my concern is not being addressed?
All I can say is the Pennsylvania Department of Health, who are doing the very best we can to address any issue.
But those dealing with the reality here every day are pleading for more than just promises.
I worry every day. You know, it's a sad situation, you know, for these loved ones to not be getting the care that they need.
Governor Wolf, you got to step in here and do what's right for the people in these nursing homes.
And Murraysville Rehab is among several comprehensive healthcare nursing homes that received PPP loans from the federal government between $350,000 and $1 million to help pay their staff. But employees tell me it wasn't until after we started asking questions a month ago that the facility finally started using a staffing agency to hire more nursing assistants, and that is starting to help. But David, truly what will help the most is when those family members can go back in there to visit their loved ones again, be their eyes, their ears, their advocates, and that is slowly starting to happen.
Angie, that's so important. I know during your reporting for the months now, you've seen family members who are really afraid to speak out, aren't they?
That is true. I see that again and again. Family members worry that their loved ones will face retaliation if they speak out, and some say they've even been shut out from getting information when they've complained. It is a real fear. So I asked Secretary Levine about it. Here's what she said.
If we ever learn of any retaliation, we would respond to our full regulatory ability. That's unacceptable.
You promise us that?
Yes.
And we will hold Secretary Levine to that. If we hear from anyone who says they are being retaliated against for raising concerns, we will take it to the top, David, and we will try to get accountability and help to hopefully make it stop.
All right, excellent reporting, Angie. Thank you very much.
We have a lot more for you on our website, WPXI.com, including an interactive map of all of the nursing homes this company owns. It's more than a dozen in our area, including Brighton Rehab.